Hello friends and colleagues, I am Stanislav Chernog, the author and creator of the School of Vector Massage and Somatics, and today we have a video that we have been planning for a long time, spent a lot of time arguing with the film crew, and in the end we still shoot a massage of the neck-collar zone. Why is this video difficult? Because the region of the neck-collar zone itself is insanely complex. Muscles and nerves, ligaments, tendons, arteries, lymph nodes and endocrine glands are implemented in a very small volume, and it is necessary to work with great care. In order to work with this zone consciously and efficiently, a high level of professionalism is required. The purpose of this particular video is to please the patient you are working with. A loved one or a person has come to work for you who needs to relax, or the one wants to enjoy working with shoulders and neck. The goal is not therapeutic, the goal is the maximum enjoyment. The first thing we need to start with is to position the patient in a convenient way. The patient should be in a position where the one will not fall forward. We specially put a chair and a couch in order to have a distinct support on the elbows. It is very important that the patient does not bend forward when we push. The cervical-collar zone ends in a class like the lower attachment of the trapezoid. This is the 12th thoracic vertebra. We will also press here. Accordingly, if the patient, when we press on the middle thoracic region, begins to collapse or sag, this is not good for your work. It is very important that in some cases the patient can turn the one's head to one side, to the other side, or fix the one's head with support on the forehead. If these conditions are not implemented, you risk that the patient will be uncomfortable. The one will have something pinched and there will be exacerbations. So we start the classic SHVZ for fun. We will do namage and there are other options. We start first of all with warming up. Apply a small amount of oil. It is better that you use less oil than more, because when there is too much oil, you do not have contact with the patient's body. Apply a small amount of oil. If there is too little of it, add more. If there is a lot, we remove the oil with the towel. Here we have the main direction of movement from the deltoid muscle of the trapezium to the spine. From the deltoid muscle to the trapezium, the spine and back. Our load is formed as follows. We raise and spread our hands, and here there is a power line that implements this load, and it is important to let the body know about the existence of this power line, and we move along the fibers accordingly. The stroking movement is not an easy movement. Your hand should stick to the patient's skin as much as possible, and you should move slowly, without jerks, sticking as tightly as possible to the patient's skin. We have a big movement from the middle of the shoulder that diverges up and down. We can make an upward movement and we can make a downward movement. Both will be very useful. The highest level of tension is formed in the trapezius muscles. Why is it being formed? This is a big, complicated issue, but nevertheless, patients and our loved ones like it when we work with this tension. Your task is not to grab the trapeze because it is painful, because it causes tension in the patient's body. Your task is to try to grasp it and to do it in such a way that you regularly fail to do it. This way you avoid painful sensations in the patient, and it will be pleasant and most safe if you do not have enough qualification. Very often they immediately begin to sink into the trapezius muscle, tight and push through, thinking that this makes it easier. No, it's not. We give the patient pleasure, and very often this is a positive moment. That's what heals. We're going from both sides. You can first work with your index finger and thumb. As you can see, the movement will go from the elbow and from the shoulder, and in some cases you can work with the base of the palm. And when you include more fingers in the work, you should slow down as much as possible, because the power of your touch increases, and if you work abruptly, it can be unpleasant, painful and not useful for the patient. It's quite difficult to do it too slowly. If you can slow down, you should slow down in a big hugging motion. it is important for you to find a state of some meditativeness. You should swing your body relative to the patient. The moment when I push forward, it is uncomfortable for me, and I, saving my lower back, begin to move along with the movement that my right hand, the far hand, makes. The next interesting movement is the movement when we move from the spine to the shoulder blade. The scapula is located right here. We move from the spine to the shoulder blade to the inner edge of the shoulder blades. This is a movement that aims to relax and stretch the rhomboid muscles. It is they who very often form pulling painful sensations on the upper back. Very often the rhomboid muscles are completely unaware of us and are patient as a problem region. And it is very important to inform the brain that here there is a certain level of soreness, a certain level of tension, and moving exclusively on the fibers able to relax this muscle. If we dive into therapy, you should clearly understand that the rhomboid muscles do not live by themselves. Very often problems with the rhomboid muscles follow from spiral lines or from problems with the hands. There we tell everything in detail. So the rhomboid muscles, the secret place of pain, people very rarely realize that it hurts there and get great pleasure when you touch this place. Separately, it is worth paying attention to long extensors. Again, you show delicacy because very often at the moment when you start working with this area, you find places of soreness. You find seals, inhomogeneities, and you want to go right there, how to suppress it. This is what we avoid in our work. We strive to give the patient pleasure. In addition, the moment you plunge into pushing treatment, you risk doing something wrong. Be careful. Obviously, I shoot on camera. In reality, I work in a different way. I periodically work with my fist. I periodically work with the base of my palm. I go in from the other side to make it more convenient for me. I can go in with both hands. There are a huge number of options. If you are working with SHVZ for the first time in this video, then do not hesitate to ask your wards how pleasant they are, how comfortable they are. Sometimes it is enough for a person to move just a little bit, and this will lead to the fact that the pleasure and therefore the benefits of practice will be much greater. Here we had a movement to stretch long extensors. We remember that this is a place where there are a huge number of problems, and treating and giving pleasure are two different formats. Nevertheless, we stretch and slightly shift the base of the palm to the middle. I draw your attention to the fact that I do this very delicately. There is a temptation to push hard. This is the wrong movement. Very slowly, very delicately, tightly, but slowly. Of course, you can work with your thumbs. For the next movement, we will ask our model to move to a vertical position. When we work professionally, we try to keep some distance. But if you work with a loved one, you can afford a closer contact. The movement when you slide the base of your palm onto your shoulders, the greatest pleasure arises at the moment when you do it very slowly. It may seem that more work will be done at the moment when you accelerate, but this is not the case. Extremely slow down. An interesting fact is that the moment you turn your head away from the shoulder, you're working with the trapeze shortens, and this allows you to relax more. An interesting point will also be the movement when you fix the weight, which is quite possible to be found in the shoulder of your ward, and make several turns in one direction and in the other direction. Your task is to avoid sudden movements. Your task is to discover how the tension state changes at the moment when you are working with the patient and to dive even more carefully and deeply into these points. A very important point is the condition of the muscle lifting the shoulder blade. Very often people do not know about its existence at all. It performs a radically different movement. On the contrary, it brings the head to the shoulder, tilts and turns the head in the direction. The place at the top of the scapula is the place of attachment of the muscle that lifts the scapula, and very often this pain is not realized as a specific place and is perceived as pain that is spread throughout the neck. The general methodology of what we are doing now is to find the main structures that control the neck and upper spine, touch each of these structures and stroke it and separate it from others. Understand what kind of movements it performs. Of course, if you understand anatomy, then the quality of your work and the result will be much better. The next structure that you definitely need to work with is the sternocleidomastoid muscle. As its name implies, it goes from the clavicle of the sternum and to the mastoid process of the temporal bone. You fix the hat around you on the stomach by the temple. Make sure that the patient of your ward is comfortable by touching the face and make stroking movements along the fibers of the sternocleidomastoid muscle. It is important to remember that somewhere here under the sternocleidomastoid muscle there is a carotid artery. There are also a huge number of lymph nodes, and somewhere a little ahead there is a thyroid gland and a trachea. Therefore, if you doubt your competence, then you should not come here, although this is a very pleasant movement. The sternocleidomastoid muscle is very tight. It is poorly recognized by our body, and at the moment when we pay attention it is very pleasant. The continuation of this movement will be the movement when you go from somewhere under the ear, go to the space above the collarbone. This is the space of the sternum muscles. A huge major topic, the pathology of the sternum muscles. Here again, if you don't understand what you're doing, if you can't be delicate enough, if the patient is uncomfortable with what you're doing, it's better not to come here. The next moment we ask the client, our patient, our ward, to move to the position of the fixed neck. Fixed hat and grab the person by the scruff of the neck carefully and begin to lift the skin. Leave the long muscles that go from the hat to the back, trapezius muscle, extensors. We begin to lift and separate them from the spine. We do it extremely delicately, without sudden movements. A most phenomenon for patients is instability of the cervical spine, and if you are overly persistent, you risk moving something in the neck. Therefore, if it is possible to work softer and slower, we work softer and slower. An interesting point will also be the position when you walk along the spinous processes and come to the occipital tubercles. The places where the short extensors are located, the attachment points of the longest muscles of the head, the attachment points of the peninsular muscles of the head. All these diverse structures that are attached here. You can also work with them by moving through the space along the spinous processes. Pay attention to the fact that the tone of these structures is different on the left and right. In this case, I see that my cervical vertebra is slightly displaced on the right side. This can be seen in the fact that the head is somewhat withdrawn to the left. Here, but we don't go in there. We just make a note for ourselves because it requires a separate lot of work. The next piece we can deal with is the work on the skin of the neck collar zone. We can capture not the muscles but the skin, and for some people it can be painful. But we will strive to make this movement as delicately and painlessly as possible. Remember that our goal is to please, not to torment the patient. We go perpendicular to the fibers of the trapezius muscle. It is also worth working in the same way with the deltoid muscles. In some cases grasping the deltoid muscle and squeezing it out, in some cases capturing only the surface layers of skin tissue, subcutaneous fat. This is also very interesting at times. And the final movement that I will recommend to you, I recommend combining with the tips of your nails in this way, quite delicately. In some cases this will cause goosebumps on the patient's body. It's a pleasant and strange feeling. Let's mix this movement with stroking, then scratching, then stroking. And at the end we put our hands together. For some time we listen to the processes that occur in the patient's body, in the body of our loved one, and at some point we gently and smoothly finish the procedure. Listen, it was so nice, I haven't felt so good in a long time. I noticed that it's very cool when you do everything slowly, carefully and subtly. You can feel that it is very pleasant. Strong, hard movements are not very good. Did it hurt you? It hurt a little. Did it hurt badly or did it hurt pleasantly? Both badly and pleasantly. I liked the long extensors along the spine, it's very nice. I advise everyone to do so. Thank you for watching this video to the end. Write in the comments how much you liked the result with your loved ones, how they liked it, how convenient it was for you to do it. Be sure to subscribe to our channel, the channel of the School of Vector Massage and Somatics, the channel where we learn to do massage and earn money or capital from it in the form of pleasure of our loved ones. And Stanislav Chernog was with you as always. See you again. Goodbye.